Okay.
Okay, so I'm here with Ahmed El Rice from
Yep.
Easy Medical, not Easy Medical Device, but EZ Medical. So Ahmed, welcome. Thank you first for this interview.
Thank you.
Wanted to ask you, so we are here at AfriSummit. What you thought about this event mainly, or the first day that you had here as a manufacturer, because you are a manufacturer.
Yes.
You have here a lot of national regulatory authorities. So in terms of manufacturing, so what's the benefit for you for coming here?
Well, just to make an introduction, we have started our production for critical care ventilators.
Yeah.
And this is the first time to attend this summit
Okay.
as a manufacturer, as you mentioned. It was really surprising to me that I've seen all the regulatory all around Africa, met them, speak with them, understand the market, understand the African nation mindset and how to go through the regulatory in each country for them, and how maybe the Egyptian products can enter these markets. So it's a very good place for networking, for understanding the regulatory mindset, dealing with people who's taking the decisions. Really, it was very fruitful meeting.
And I think, as you mentioned, it's interesting because you meet the national regulatory authorities. So then you directly have access to the people that can authorize your products in the country. So they can give you tips or how to do maybe things, no?
No, actually, we are very good terms with the regulatory affairs in Egypt, and maybe they were the one who are introducing us to other
Okay.
regulatory bodies in all Africa. So yeah, we had a long time to get our license, but finally we had it, and now we are exposing ourselves to the African nations, and hopefully we can do a great business with
So
them.
do you have a first country that you are really targeting, or no, you have really...
Actually, I'm targeting, of course, beside of Egypt, I'm thinking of like Kenya.
Okay.
I've been with people here from Kenya, which is very promising. South Africa also is very promising. Zambia, of course. And I think also if I'm looking for Africa, for North Africa, will be good, like Libya, maybe Tunis. Tunis is very easy to go in. Maybe Algeria. So we
So
are making our plan now.
there are really some opportunities to open new markets for you. So because when we are, for example, in Europe, we are more thinking to go to USA or to go to Asia. Here you are in Egypt, and going to Africa is your first priority for the moment.
There's a lot of things that will make us go to Africa. Maybe one thing is we have a lot of treaties with Africa, like the COMESA, like the Africa Agadir, and even the Arab treaties. So Africa is a very good market for us. Of course, we believe that our device is top in class, and we can compete with the other higher products very well. Uh, Europe is the next stage for us because actually we need to have the CE first,
Exactly.
and this will take some time because a country not from Europe during these days will be a little
Exactly.
bit long term.
And even with the fact that you have never had a discussion with the notified body for the moment,
Yeah.
so first starting that is also something
It
that
will
can
take
be,
some time.
Yeah. But the from what we discussed, the already level that you are for the registration of your products here in Egypt are nearly at the level also of Europe. So it's not like because you already have clinical data, you already have all those things.
Yes, it took us like 4 years in
Yeah,
Egypt.
it's what I'm
So
saying. So
I
for
believe
me, it looks like a good high level. So that's why I'm asking.
so. It will take some time to understand, of course, the European mentality because definitely they're looking for things we might not look for it in Egypt. But at the end, we have to get aware about the CE and take all the let's say the talk
Yeah.
and make the walk. Having also a local representative in Europe, something we will look for.
You
So
you can look for easy medical device.
sure, we can discuss this together. And even having a notifying body
Yeah.
who have the scope of medical ventilators, and at the same time have the time slot that we
Yeah.
can reduce the overall process.
So great. So you have a lot of things to do in Europe, a lot of things to do in Africa.
Yeah, sure.
I wish you really all the best.
Thank you very much.
Thank you
Thank
very
you.
much.
Nice to
Thank you.
meet you.
Thank
Thank
you.
you very
Bye.
much. Bye.